Doctor-patient relationship. A doctor-patient relationship is considered to be the core element in the ethical principles of medicine. Doctor-patient relationship is usually developed when the physician tends to a patient's medical needs via checkup, diagnosis, and treatment in an agreeable manner. Due to the relationship, the doctor holds the responsibility to the patient to proceed toward the ailment or conclude the relationship successfully. In particular, it is essential that the primary care physician develops a satisfactory doctor-patient relationship in order to deliver the prime health care to patients. Here we can look for the fundamentals for the dynamic DPR. Several medical reviewers have covered the ways to form a relationship between the physician and the patient. Some essential features are important for maintaining the healthy doctor-patient relationship that are covered in more detail below. One is communication. Good communication skills are essential to establish the DPR. Studies have revealed that the effective communication between the physician and the patient has resulted in the multiple impacts on the various aspects of the health consequences, such as improved medical, functional, and emotional conditions of patient, better patient compliance with the medical treatment, enhanced fulfillment of the patient toward the healthcare services, lesser risk of the medical misconduct. Doctor empathy. Empathy is vital to ensure the quality of a DPR. This enables the physician to understand the symptomatic experience and the needs of the individual patient. Studies have suggested that the physician empathy improves the therapeutic effect and the patient's quality of life. Trust. Trust in the doctors allows the patient to effectively discuss the health issues. Development of a trust enables the patient to comply with the doctor's guidance, which consequently results in the improvement of health. Informed consent. This is based on the moral and the legal arguments of the patient's autonomy, that is, independence in the decision making. In relation to trust, the physician needs to be honest with the patient and his family to provide a genuine assessment of the favorable and the unfavorable outcome probabilities along with the suggested therapy. Professional boundaries. This deals with any behavior on the part of the doctor that transgresses the limits of the professional relationship or the boundary violation. For example, the following behavior should be avoided to respect the professional boundaries between the doctor and the patient. Observing the patient in the unauthorized setting at the convenience of the physician. Burdening the patient with the personal information. Models of DPR. There are 4 models of the approaching DPR. Paternalistic approach. In this model, the doctor generally dominates the interrogation and the patient is expected to comply without the questioning. Here, the physician acts as a guardian because he or she independently promotes the patient's health condition without the later consent. This autocratic model of the DPR is usually advocated in the emergency situation as obtaining the consent from the patient in such a situation might alter this medical condition. Informative model. This is also called the consumer model. Here, the physician acts as a proficient technical expert by defining the appropriate factual information about the possible treatment provided for the patient and implementing the patient-selected intervention. In this model, the patient is in the charge of the decision-making for his medical condition. This kind of model is restricted in the patient-centered medical operation. Third is interpretive model. In this model, the physician plays an advisor by explicitly and interpreting the appropriate medical status of the patient. The physician acquires the consent from the patient and uses the patient's decided intervention. Deliberative model. In the deliberative approach of the DPR, the doctor is the teacher or the friend towards his patient. The doctor enunciates the treatment measures and convinces his patient of the more valuable medical measures. The patient's consent is also important for implementation of the treatment. Termination of a DPR. Innumerable situations might bring about the physician's discharge of patient and the ending of DPR. The relationship may come to an end when the physician concludes the patient needs the care of different specialists. Successive missing of the appointment by the patient. The physician refuses the treatment due to the nationality, religion, and the other causes. Neglecting a patient from the prompt to professional care without making the arrangements for the continuance of such care, the patient's abandonment. Impact of the DPR in the medical specialty. Chronic health. The physician who communicate the well and treat the patient with the chronic illness fairly improve the patient's ability to manage the disease independently with the adherence to the advice of doctors. For example, patients monitor the blood pressure and other to the medical treatments as per the advice of the doctor to manage the health disorders such as hypertension and diabetes. Psychiatry. The DPR helps in the good therapeutic outcome in the field of psychiatry. The psychiatrist-patient relationship enables the psychosomatic patient to overcome the mental symptoms through the better rapport with them. Studies are revealed that the psychotic symptoms in the HIV patient are treated by retaining the patient's hope and giving the adequate data regarding the disease and the treatment. Nowadays, in some places, practices like the corruption in the health management and industry inequity in the healthcare delivery and the measurement of the health insurance have altered the relation